Hey everybody, I'm Paul Kokity, licensed massage therapist, and I'm back once again for another video. This time it's going to be a video that's a multi-part video for talking about the underlying distortion that we all have through our bodies. This video will be more of the modeling part to illustrate it, as well as to show what I do actually for helping to get my clients better. It's a major building block of most of my posture body work that I do for clients, because it's really what just takes things to the next level and allows for me to get awesome results for scoliosis. It's also great for a variety of injuries, you name it, because this spiral formed well before we were born. It creates a distortion in us, and any injuries we accumulate through life gets built on top of it. So if we knock out the spiral, it makes it easier for us to work with anything else going on in the entire body. For this video, I have a model behind me that I can use to help illustrate what the spiral is, and then I'll take her through core distortion release protocol, the particular craniosacral protocols that I do for helping to unwind the body, and then I will be able to show you afterwards exactly what it does for generating the change. The first thing to look for when I evaluate how bad the spiral is in the body is for looking at the hips. From the back view, it's easiest to identify this. There's a way that, like, physical therapists will assess you from the front of the body to try to decide which hip is tilted forward, which hip is tilted back, which hip is the anterior hip. But I don't particularly agree with it. So the first thing I usually do is to assess from the back, that I feel for landmarks on the back called the PSIS, or posterior superior iliac spine, if you really want to know the anatomy. My left thumb is a little bit higher than the right thumb, resting on top of her hip bones. That shows that the left hip is tilted forward, the right hip is tilted back relative to each other. I'm not talking about the overall pelvic tilt, but how the two hip bones are related to each other. Most people have this pattern. Only about 1 in 500 people have the opposite torsion to the hips, and that's because, according to developmental biology, roughly 1 in 500 people have an opposite twist to their colon. So the vast majority of us have this pattern that the left hip is forward, the right hip is back. I like to assess back here. Now, there will be people that will say that there will be buildup of tissue on top of the hip that distorts the ability to assess this, but by laying the hands over the top of the entirety of the hip, you can feel the shape of how the hips are twisted. Now, I've already done a little bit of body work to her for one session before this, so I think I cleared out some of that. But a lot of people, to counterbalance the left hip being tilted forward, we crunch into the right side. Now, from the back view, we don't see as much of the crunching here into this right side, but we may be able to see that from the front view easier. Now, for her spine, this is a fairly nice straight spine. Hopefully I have a model pretty soon that will be able to illustrate a more scoliotic spine to show the extreme collapse into the spiral pattern. With the hips twisting like this, there gets to be compensation that goes down through the legs, because the hips being off like this means one hip socket is lower to the ground, which by design, this left hip being tilted forward brings that left hip socket lower to the ground, which means we have to absorb leg length through this side, which means a buckling down through the left leg. It's a little bit hard to see the core pattern because she has a little bit of internal rotation in this right leg, but the left knee by design for the vast majority of us will be more internally rotated. Now, the only time I really see the right side suffering is that someone had injury to their right ankle, sprained their ankle, something like that they threw into a different pattern. So by default, our left knee is the one that deals with the strain. Right side suffers more so if there's been a right side injury. And then the last part of this, for helping to show the upper body, is that just as there's a twist down here, there has to be some sort of compensation that takes place in the upper body. Now, if you think of how your arms swing opposite of your legs, we get a similar pattern in that the strain pattern in the shoulders is that by design we get more internal rotation in this right shoulder. It's like it's trying to get across the body to go to that left hip that's tilted forward. So maybe you can see it in this video, but this shoulder blade is more diagonally orientated, that it's getting pulled into this internal rotation in this right side. But something still happens to the left side, that usually it's the bigger external muscles that tense up, so this left shoulder blade is usually hiked up a little bit more. She has a little bit of internal rotation over here, but it's a different thing as to what's dominating, feeding the source of the problem. The right side, it's about the rotator cuff. The other side, it's about the bigger extrinsic muscles feeding it for feeding tension. Here, this is more of a straight up knot, whereas this is more of a diagonal pull with a little bit of a hollow directing this way. So this is pretty much the default pattern that most of us, the vast majority of us, have. This is what we fight. Now, in this case, it's not a huge extreme example of this core distortion, but the great thing is she's fairly pure for the distortion, for being able to illustrate what's going on. All right, now on to the front view for starting to identify things. The easiest place for looking for the core distortion in the hips, for the front of the hips, is to look for really how the abdomen, the belly is shaped here. When we look from the front, there will always be a little bit more tissue on the right side, and that's because with the left hip tilted forward, the tissue falls forward, including the abdominal organs. So there usually is some more mass to the left side. And then usually there's a counterbalance to crunch and tighten on the right side. What I was saying about the mainstream approach for assessing the hips, that they like to look at the front of the hips by assessing the ASIS points on the front. There are ways that the right side can look lower. So the general thought is if it's lower, then that's the hip that's tilted forward. But it's really not a case because of the way the hips can be off kilter, tilted to one side or the other, or tucked under on one side, that it gets assessed improperly. Now from the front, she looks almost level if you just went off of the mainstream PT way of assessing things, but it's really not true. So on the back view, we can assess a little bit better to see what's going on in the SI joints, the sacroiliac joints that rest between the sacrum and the hip bones on each side, to see what's going on there. And like I said, by laying your hands on top of the hip bones, you can feel the actual way the hips are twisted. Now from my assessing these, her knee looks like it's at this kind of angle for the left side. The right knee is not as much angled. So from the front, we can definitely see that there's more of a collapse through this left leg for attempt to absorb leg length issues. Both knees are actually a little bit internally rotated, but this left knee is more internally rotated. And if we compare the foot alignment, the foot is externally rotated. So that means there's twisting and compensating going on here to absorb leg length issues. Can I stand from this side? No, easier. So now what I said about the shoulders, now we can see much easier the pattern that I was talking about in the shoulders. What I said about the left shoulder being hiked up and more tensed just straight up, and that the holding pattern is here. Yeah, this is the left shoulder, whereas this right shoulder from the front view on her, with the camera angle now, we can definitely see the slope going into this internal rotation. This bump that's more here is because of that right shoulder being more internally rotating, and that feeds all the strain into here and also feeds strain down through the arm. Now throw in the complications of being in a right-handed world, it just helps feed all the stuff going on here. Awesome model. Give her a hand. So this is what we fight while we try to take care of whatever issues are going on in your body. What I'm about to show you is what I try to do as soon as possible with any client that comes in to see me. It's a cranial structural protocol that I learned called the Core Distortion release. Now it's called cranial structural because the person I learned it from said they wanted to differentiate from craniosacral therapy to say that we're more focused on the structure rather than the circulatory and energetic effects of craniosacral therapy. So I like to do this next protocol that I'm about to show you as soon as possible for being able to create change in the body, because really, once we unlock this stuck static spiral that we're born into, everything is more dynamic to be worked with.